So thank you, Dr. Nekeshia Hammond, for being here today. I really appreciate you taking the time out to be on the Mental Insights podcast and share some of the insights that you have within mental health and some of the factors that can play within a child's development as well within parental figures. To start out, I think is a really great question of when did you truly become passionate about mental health and the topic in and of itself, whether it was when you first heard about it or when it first became a priority within your life?
Yeah, that's a great question. So I started learning about psychology actually in high school, and my last 2 years of high school. And then going into college in the undergraduate years, when I learned about the impact that you can make in the field of mental health, particularly with children and teens, I got really, really excited to really get into this field. So I would say like high school and early college is when I really started developing a stronger interest of mental health.
That's awesome. Thank you for that. It's
Yeah.
definitely a great thing to see that at such a young age you became passionate about it because, as I'm sure you know, it's a field that is certainly lacking within the amount of mental health professionals. So it's great to see that at such a young age you could see that inspiration because there
Mhm.
are a lot of people that experience it and then truly realize that they can make a lasting impact within the field. So it's definitely nice to see both sides of you were so passionate at such a young age, and because a lot of people, they don't necessarily even know or understand what mental health is until they experience a challenge down the road within their life.
Yes, very true. Yeah, and I really thankfully. So for undergrad, I went to the University of Florida, and go Gators. And I thankfully had the experience of, not necessarily because you can't in the undergraduate years necessarily treat mental health, but I had the opportunity to see some patients and to hear their stories and what they were going through, and be a part of this research program. And I think through that, just really, it's really different when you hear people's stories. And I know you know this because you do this podcast, definitely. So you've heard the stories. It just impacts you so much differently. So I think because I got the opportunity to hear those stories earlier, I'm like, man, I really want to get into this work to help people. So it's pretty cool.
That's so awesome. That's great that you were able to see that. I think seeing the tangible, really
Mm-hmm.
actions that people experience and so forth, it opens your eyes and brings into that perspective that there's a lot that people face and deal with.
Yeah.
And, yourself learning all about what people can experience and ways to move forward is
Mm-hmm.
so impactful on, a whole nother level because for a lot of people, the mental aspect is not something that they can't truly control, at least not in the beginning of their development.
Mm-hmm.
So,
Yeah. Something to learn, right?
so within, what you work, specifically you focus on ADHD. Why don't you just
Mm-hmm.
give a little bit of insight in terms of the work and services that you provide, and then we'll dive into more within ADHD and the, steps that you work towards providing a mentally well individual.
Yeah. Yeah. Great question. So I really, at the beginning of my career, this is my 10th year now in private practice. At the beginning of my career, I spent, uh, I guess, 60-40% therapy and evaluations. And then about 7 years or so ago, I started really more focusing on evaluations. And as you mentioned, one of my subspecialties is ADHD. And really, what I've seen is that number one, there's so much misinformation out there, unfortunately, about ADHD, but getting an appropriate evaluation, a thorough evaluation, can really, really make a difference in the lives of not only the child or the teen that's getting this evaluation, but their entire family. So it's definitely been some interesting work, and very impactful, I feel like, for the families.
That's great. Thank you for that. And, to dive a little bit into that, for a child that is going through something such as ADHD, they don't necessarily have the tools and resources to change within their own life. And obviously, that brings the factor of how important parental figures can be
Mm.
within the childhood development. So what are some, tools, and what are some different, opportunities that you provide for parents to make such a lasting impact on their child who may face ADHD?
Yeah. So the very first thing is, and again, I'm a psychologist here, right? So a psychological evaluation is so important because one of the issues, particularly with ADHD, because it's a term that gets thrown around so much, is it's unfortunately misdiagnosed very often, and it's just easily labeled. So generally it could be a teacher, it could be maybe even a parent or someone else. They'll see a child within 5 minutes. It's like, you have ADHD. Which is not necessarily always the case. So the first thing I tell parents is definitely make sure that you get a thorough psychological evaluation, which means that you're looking at, is there any social issues, emotional issues, learning issues, depression or anxiety, or, there's so many other things that could be going on. Because really the first step, and I think the first step is so critical, is to know what you're even dealing with when it comes to mental health, instead of guessing for kids and going down a path that you don't want to go on. So that would definitely be the very first step, I would say, for parents to really see if their child has ADHD. And if they do, then, as you mentioned, there's a lot that can be done to help children.
Wonderful. Thank you. And, there's obviously, like you said, there's a lot of misinformation that's out there. There's a lot of misdiagnoses. There's a lot of people diagnosing themselves, and obviously that can play a big harm. So can you speak upon that, and what are some misconceptions that are tied towards ADHD?
Yeah, there's a lot. But some of the main ones that I hear so frequently, well, one of them is that people think that everyone with ADHD, and I know the name is a little confusing, attention deficit hyperactivity disorder, but they think that everyone with ADHD is hyperactive, which is not always the case. So there's something that in the pediatrician world, they call it ADD. But in our world, psychology world, we have 3 types of ADHD. And one of them is a type that someone is having problems with attention, but they are not hyperactive or impulsive. And that type of ADHD gets missed a lot, especially for girls. Like, generally, they'll say girls are daydreaming or they're not paying attention in class, but they're not necessarily hyperactive. There's no behavioral issues. And unfortunately, those kids sometimes get missed as far as for treatment. So that's definitely one myth. And I think the other myth that is very concerning is that because we are so quick to label ADHD, which may or may not be the case, we're completely missing the rest of the child. Which is a myth. It's like we have to look at the whole child. There could be a medical issue. Some kids are so brilliant. I've tested their IQs and I'm like, you're a genius. You're really, really smart. We've totally neglected that part, and they're bored out of their minds in class. So is it that? Is there a learning issue? Is there depression? Is there just something happening at home that they're dealing with? There's all these other things to consider, but we don't tend to look at the whole child. So I would say those are the 2 major misconceptions. I mean, there's a whole bunch, but the major misconceptions when it comes to ADHD.
That's great. It definitely brings up a lot of, topics within the role that environments can play, and, how there's a lot of different factors within someone's development, and it doesn't necessarily mean that they don't fit into the way that, society has this, path. Some people are different. Some people are creative in other measures. And there's certainly cases, within a lot of people who have been diagnosed with an ADHD that they might just need another route, or they might just be down a different path.
Definitely. I mean, what's not weird, but what's interesting when it comes to attention particularly, and people don't necessarily always remember this. I think when people hear this, then they'll be like, oh yeah, that makes sense. But when it comes to attention, think about, and I'm saying for anyone listening, think about something that's happened in your life that was upsetting to you. It could be anything. It could be the loss of a loved one. It could be a breakup of a relationship. I mean, it could be the loss of a job. I mean, whatever, something that's happened that's upsetting, you probably are going to have a hard time concentrating because you're thinking about that particular thing. And it's the same exact thing for kids. When they're in the middle of going through their parents' divorce, they got bullied at school, they got a bad grade on a test, whatever it is, there are many kids that have problems concentrating, but it doesn't always mean it's ADHD. So that's what I hope, if anything, I hope people remember that. That's why it's so critical to really get properly evaluated, because there could be a lot of other things going on besides ADHD.
That's a great point to make, because obviously a lot of people can have one instance that they try to necessarily define themselves as, but it's just one hurdle. And comparatively to people who actually struggle with ADHD,
Yes.
Measure that happens, if not every day, that can drastically affect not only, when they experience these negative impacts, but even when they don't, it's still something that's impacting them that they necessarily can't control, or maybe are not aware of when they're at such a young age.
Exactly.
And, I spoke a little bit about having the impacts of an environment. And, I think parental figures are definitely something that can drastically change a child's development. Speak about the role that a parent can play within their child's development, whether it's what the parent is impacting them throughout their own mental health, or how they can play a positive impact throughout, their development through one of these, whether it's ADHD or whether it's suffering from depression or anxiety. How can a parental figure be such a important factor and role within their environment?
Yeah. So parents or caregivers or whomever is in the home for youth absolutely have an obligation to be as supportive as you can. Some of the things that I've heard, though, is, well, I'm too busy, or maybe I have multiple jobs, or I have something else going on with myself, as a parent, so I can't be emotionally available. And I totally get that, because I've met many different types of families in different situations. So what I say to that is, if you're in that particular situation, then make sure that someone in that child's life is there for them. That is the biggest thing. Connection to something or someone positive is going to be the most critical thing that you can do for your child. And again, if for whatever reason you can't be the one, if it's your mom, your sister, your brother, your coworker, your best friend, someone at your place of worship or wherever, someone needs to be with that child and supportive of them. The second thing I would say is that I really truly feel it's a gift to give this to kids, is teaching them how to be emotionally healthy is so critical. And I think we've forgotten about that as a society a little bit. It's more like, okay, go to school, do your schoolwork, behave, and that's it, and do it all over again. But it's like, well, hold on a second. We need to be having conversations. It sounds a little silly or basic, but when kids are kids, we have to have conversations about how to be kind, how to be appropriate, how to be emotionally healthy. What do you do when someone bullies you? And all these types of really important conversations, because really, if children it's not just about childhood, but if children learn how to deal with emotions from a young age and can bring that into their adult life, you are seriously giving them an amazing gift. So that's really two things that I want parents to be aware of.
That's great. And, the aspect of emotional learning, I think, is so important, especially for children, to start that at a young age.
Yes.
A lot of what, I see within the mental health field is that if at a young age they experience an emotional trauma or an experience, that often leads to a lot of different emotional responses or behavioral responses that drag off for 10 years, that change the way that they even think of themselves, the way that they interact with themselves and other people, which drastically can, bring about a very negative aspect of their own mental health. And, they can severely suffer from depression and anxiety for years later, because they don't necessarily know how to behave or respond to some experiences that may have re-triggered what they had before.
Right. Absolutely accurate. And that's one of the reasons why I love I mean, I've worked with all ages, but I really love working with children and teens because you're absolutely right. To me, to get to the root of what's going on, and now again, I'm doing more evaluations, but even within treatment, it's so much easier to treat something that happens at 10 years old versus when you're 60 years old, 70, 80 years old. There are people that are 80 years old that are still trying to cope with things that happened to them when they were 10. And it's sad because, I mean, there's a lot of reasons, but one of the reasons could be because maybe they didn't learn to deal with it. Nobody was there to process that trauma or whatever happened for them. Nobody was there to really explain that, because for kids, they cannot process things like adults do. They do not have the brain capacity. And talking to so many children one-on-one, they really distort things. They just do, because when you're 6, 7, 8, 9, you can't process it as an adult. So you distort a lot. And then what happens is a lot of kids blame themselves for a bunch of things that are not even their fault. So I totally agree with you. It's so critical for our youth to be learning how to deal with their emotions so we can really prepare them for their adult life. So critical.
It seems like, emotional learning is something that definitely needs to be really driven hard within, whether it's within school education or whether it's just a separate resource that we provide. But emotional learning is definitely, I think, one of the biggest factors within just development within a human. It works within all aspects of whether it's your social life, whether it's your work environment. There's many different factors within just being able to behave and respond in an emotional, healthy manner.
Yes,
which definitely impacts any relationship that we can have within our life.
Exactly right. It's funny you just said that because I was on another interview recently, and actually the host was saying the same thing. That she was like, yeah, it doesn't impact a different relationships. But I'm like, yes, absolutely. Whether it's your romantic relationships, your friendships, your relationships that in your jobs, it completely does. And luckily, in Florida anyway, where I'm at, they just passed that I believe middle and high school students are going to be required. They haven't implemented that obviously because they just passed it, but they'll be required to have mental health education. And I was just like so excited. I'm like, thank you so much, because finally some schools are starting to recognize the social emotional learning and how drastically important. I even saw on Twitter like Lady Gaga is advocating for this too, and I'm like, yes, I'm like celebrating as a psychologist, because I'm like, we're doomed. Like, it doesn't matter if a child has straight A's and your science facts and reading or whatever. Not that education is not important, but if you know all that, but you can't manage your emotions, you're not set up to succeed in life. You're not. Life is going to happen. Bad things are going to happen. Good things are going to happen. I mean, we all have our emotions, going all over the place, but if you can't manage it, it's a lot of heartache that's unnecessary that's going to happen.
Definitely. I think we're just setting up a lot of people to, fail in a lot of different areas, whether it's communicating or whether it's just having emotional responses to yourself. There's, emotions are a factor that we play with every single day. And it's something that if we're not taught, then you can see how people can't communicate their emotions effectively. You can see why divorce is like one of the highest rates that it has been. It's like over 50%, I think, right now. So like there's clear factors that emotional learning is going to change the way that we can interact and communicate with each other.
Yeah.
And, so emotional learning obviously is something that we need to bring within the youth as much as we can. For the way that you work within children, what are some ways, whether it's within emotional learning or whether it's just within improving their own mental health of, different activities or routines, what are some opportunities that you share within your children just for different types of habits or proponents that they could focus on to improve their own mental health?
Yeah. So a lot of times when I'm doing these evaluations, I spend a couple hours actually with a child, and we're taking little breaks and things like that, of course, with the testing. But usually in there, we start talking about, things they like and their interests. And what I try to just throw in just a little bit, I'm not doing therapy, but is to help them with their self-esteem. Because a lot of times what I found with kids, especially like the middle schoolers, it's so hard to be in middle school, oh my God. But especially with middle school is if another peer says something that's totally inaccurate, it's true to that, 11, 12-year-old. And I'm like, no, it's not. Like whatever it is, it could be, this peer is saying you're ugly. And I'm like, you're gorgeous, like you're beautiful, right? Or that they're stupid. And I'm like, you're a straight A student, like obviously you're not, but it doesn't register like that. So I've really been trying to help youth and it takes time, but to remember that just because someone says something about you does not make it true. And I'll even confront them, in a therapeutic way a little bit, just like, you think you're stupid? And they're like, well, whoever such and such said I'm stupid. I'm like, but what kind of grades do you make? And they're like, I make straight A's. And I'm like, well, then you're not stupid, right? So just little things like that, but also reminding them that, especially with kids, when I have the feedback session, I go over whatever it is that may be going on with them, if it's depression, anxiety, or ADHD. I want to really remind youth that does not completely define who you are. That's like one little piece. Yes, you may have depression. Okay, one little piece of you. But there's all these other positive, amazing things, and I'll even remind them of the things and your strengths that make up who you are. Because I've had just very different responses. Some youth are good. They're like, yes, I have, anxiety or whatever it is. And for some youth, it's really, really hard to deal with because they think that that's all they are. Like, I am anxiety. And I'm like, no, you have some anxiety, but you have so many other great things about you. So that's what I, really try to instill in youth. I think as a community, if we can just keep building our youth up, there's so much negativity, especially on social media. It's horrific, what they hear and see. So if we can just keep building them up, would be amazing.
That's great. I love that perspective, because definitely I think self-esteem is one of the biggest proponents within what a lot of people struggle with. And it's also due to, this characterization of why there's so much stigma around mental health, meaning, this is what defines me and this is who I am, exactly to what you're saying. It's, there's so much more about you. And it's, I think, opening up that perspective and that door for whether it's children or even adults to see that it doesn't change who they are. It doesn't, that's not within your description of, who you are as a person. And if anything, that's something that majority of people have within, their titles. Like, everybody has experienced some sort of, anxiety within their life. Most people have had a depressive episode. And mental health is something that we all deal with. So creating that conversation, like you're saying, I think is so vital to change the way that we perceive mental health and perceive someone who's experiencing a mental health condition. I think, we need to start changing the conversation and making it more open for people to seek out the services, because I've heard that, and personally through my own experiences, a lot of people don't seek out the help due to what will be attached to them due to, seeking out services. And, that's something that we need to change, or else we won't be able to help everyone who's struggling.
Yeah, it's hard. It's so hard because, as you mentioned, definitely we have the stigma. I have reminded some of my youth that there are millions of people that deal with depression and anxiety, and their faces are just like, really? Because it feels so isolated. It feels like they're alone in it, and they're like, I'm the only teen that has, depression or anxiety. I'm like, actually, there's millions of people, right? And so it's hard because, millions of people that we know of. And then, of course, there's a stigma. So there's a lot more people that we don't even know about because people are afraid to, to really seek services. So I see it. I see our society changing. I know we have a lot more work to do. But really, I think sharing resources. I do something called Mental Health Moment every Tuesday evening on a Facebook Live page. And it's so cool because some people will be on there and they'll say, like, I have depression, or I have anxiety, or I have this. And I actually get excited because I'm like, see, I'm not telling anybody, to say, if you want to say what your condition is, great. But I get excited when people are willing to do that, because we would so easily be like, oh, I have the flu today, or I have a cold, I broke, my arm or whatever. But we can't, it's like, we can't ever say that we're anxious or we have depression, because we're not quite there yet as a society. So when people do open up, I just really get excited, because I see the trends changing, and I'm really excited about the stigma being reduced for mental health. So
I completely agree. It's definitely something, as you spoke about the, negativity on social media, you still can definitely see that the stigma is being reduced.
yeah.
That's one thing that I think I am so happy about doing this podcast, is when I interview some people who share their own personal experiences, it kind of feels like it's not only a weight off their shoulder, but mine too, because it's allowing people to understand that, anybody and everybody experiences these mental health conditions, and it's, making people more comfortable, I think, to reach out and to even, like you're saying, just even having a comment on a Facebook or anywhere online, just saying, this is something that I faced.
Yeah.
And it's something that everybody does, and it's nothing to be ashamed of. It's nothing, to change the course of who you are. It's just, one aspect, one experience that you've had.
Yeah. I've gotten even more excited too when some of the celebrities lately have been really coming forward and saying, I have, whatever, depression or bipolar disorder. I've been to therapy. I'm currently in therapy. Like, I get so excited, because it just shows, like, there's not this, there's this weird stereotype of what mental health is. Like, no, it doesn't have a face. Like, it can be any nationality, any race, any religious belief. You could be a celebrity. You could have millions. You could be, not have a home. Like, it's not this, I don't know, this negative person or ideal that people think it is. Like, it affects, it doesn't matter how much money or how much money you don't have. It doesn't work like that when it comes to mental health. So I get super excited when many of the celebrities now are like coming forward and using their influence to say, you know what, it's okay. It's okay not to be okay. It's okay to go to therapy. It's okay to seek out help, but just get the help you need. So that's been really cool to see lately too.
Definitely. I completely agree. It's something that I think, people of that, stature, of, that fame and fortune, I think can change the course of a lot of young people, especially because it's people who they look up to. And if they, say that they seek out services, or if they go to therapy or this, that, the other, young children can see that maybe it's okay if I go, ask for help, or if I just go and speak to someone and they just listen to me, because oftentimes just someone listening to you can be the game changer. That can be what, changes the momentum of you saying, this is something that will be good for me, and this will like change the course of, how I feel, whether it's my emotions or whether it's just my connection with another human.
Yeah.
For young people, we spoke a little bit about, the role that an interaction with someone else can cause harm. And I think, especially you were speaking about middle school, bullying can obviously be a big role within someone experiencing, whether it's a mental health condition or whether it's just changing the way that they act and behave throughout, their own experience throughout, whether it's throughout their school or whether it's when they go back home throughout that environment. Can you speak about the role that bullying can play within a child's environment, and, how that can change their development?
Yeah, it's hard. I've met too many children that have been victim of pretty severe bullying, and we know from the research, it can have pretty dire effects. So it can affect academically. It can affect, again, like you said, how you even think about people. There's youth that go through such severe bullying that they don't trust others, which makes sense. So not trusting others, affecting friendships, relationships, work, productivity. It really can have some difficult effects. But I think hopefully what's coming through now in the research, and what some schools are trying to do, is work on what we call the bystanders. So when a child is seeing other children being bullied, which drives me nuts, but instead of using your cell phone to videotape a fight or someone being bullied or someone being put down, what are some positive ways as a bystander that you can help? And it doesn't always mean intervening. I'm not saying every child should jump into the middle of a physical fight here, but there's things that you can do instead of egging on the situation. And now there's 8 children making fun of one child. You know what I mean? So we're starting to have those conversations in school, thankfully, because the research clearly shows, and it completely makes sense, that kids don't generally come home and say, guess what, mom, dad, I was bullied today. They're not doing that, and they're keeping that to themselves. And then what happens is, depression starts to come about, anxiety starts to come about, hopefully not, but sometimes thoughts of self-harm come about. So it can really have some impactful effects, especially middle school years. It is just a really tough time for bullying and the cyberbullying and, on social media and all that. So really difficult, but I think there's still a lot of hope as we move forward.
That's great. Yeah, it's definitely, there's 2 sides to it. And obviously it's very contradicting with, the social media and the online aspect of it, which definitely causes a lot of difficulty nowadays. And I think it's creating that barrier to allow children to know that, what they read and hear is not always the truth. And, that brings us back to what we were speaking about earlier is, if whether it's, you're struggling from a mental health condition or whether someone calls you a bad name, you have to understand that there's a lot of more qualities about yourself other than that. And that's something that I think we need to create a better image of. And I think, learning more about, what you can see positively about yourself is definitely a great step into, managing that. As well, when you're talking about, the recording of a fight and such, I think the actions behind the screen, so the actions behind, if someone is doing the immediate bullying, but the person who's letting that happen, that still speaks volumes about that person. And I think affects them as well, because, they'll go home and they might not necessarily talk about it to, their parents or their friends, but that alone can still build up inside them. That can change, their own behavioral responses. That could make them, always try to fit in when there's those kids that are trying to, be the majority compared to the minority who is being bullied or being harmed. And, that creates that, opportunity for people to, seek out the self-harm because they feel so alone. They feel like they're not worthy. And that's something that we've actually seen a lot throughout the past couple of years. I've seen all over in the news is that people are being bullied, and then that ends up leading to a self-harm or a suicide, which is, it's so sad to see at such a young age that a child thinks that they're truly not worth, moving on to the next day. And bullying is definitely something that I think we need to take big control over, because as we're saying, the social media aspect of it, I think, is driving a lot of children into this negative belief about themselves and about, their own image and who they can't be. And I think that causes a lot of harm for whether it's self-esteem or whether it's just their emotional responses and coping.
Yeah. It's really hard. The social media piece, because I just saw something the other day, and who knows, what'll happen next couple months or next year, but I saw that, I believe it's Instagram, they were considering, I don't know if they'll do it, but they were considering removing the likes, like if other people go to your page, the likes that you have on a post, because in many other countries, apparently they don't have that. So you can see your own likes, but for someone else to go on, because that causes so much anxiety oh my God, I didn't get, 300 likes or 3,000 likes or whatever it is, which is, as adults, we can, for some adults, we can, see a different take on that. But for a lot of teens, it causes distress about that, not to mention so many of the comments. when I read people's comments, sometimes I'm floored. Like, just the fact that people can say that. But again, you're behind a screen, and sometimes you can use a fake name and all these things. So people just say a lot of really offensive things to our youth, which is very difficult to deal with because, nowadays we're not just dealing with bullying in school. You go home and you're on your cell phone, which you are if you're in middle or high school, and you're just constantly being bombarded with negative messages. So that's why I like what you reminded us of too, that having the positivity, thinking highly of yourself, it doesn't take away the hurt of being bullied, but it does create some sort of a shield a little bit. So maybe those types of negative messages won't go in as deep. And that, I think, should be our goal. We can't protect our child from every negative message, but we can build them up to the point where they, instead of going from like just dropping, it's like, just a little bit of hurt, but we don't want to get them into a place where they're really considering, harming themselves or someone else. So.
Thank you for that. I appreciate it. And, the revolving topic, I think, is, this anxiety, this stress that is caused a lot throughout, whether it's social media or whether it's an experience that a child had throughout, school or a home environment. So for a lot of people, I think, whether it's the past, whether it's an experience that they already had, or whether it's the future of them having an expectation or an anticipation about something, for the work that you do, what are some ways that someone can learn to be in the present moment and learn to be aware that those things happened or will happen, but that they can't necessarily allow that to consume everything and all of their thought processes throughout the day?
Yeah. So especially when it comes to anxiety, something that's really good, and it doesn't even have to be, I just want to clarify, for everyone, when we say anxiety, it can be an anxiety disorder, but it can also just be a lot of anxiety and not be to the level of a disorder. But in either case, really practicing mindfulness is really critical, even for our youth. And it's pretty cool when youth are able to learn to live in the present moment. And there's literally basic things that are, sort of child appropriate that they can practice, which is even when you're brushing your teeth, for example, when you're teaching to be clearly in the moment and you're thinking about picking up the toothbrush and putting the toothpaste on and brushing your teeth and rinsing it out. And when you're clearly thinking about that, you are being mindful, you're in the present moment, which in that moment, even if it lasts, for a minute or two, can bring you some relief from anxiety. And also something that's really good is teaching youth how to do deep breathing, which is my favorite thing in the world to ever teach. I do a lot of yoga. I've done yoga since graduate school. And I think it's so easy sometimes, though, that people are like not believing that it works. But it really does work. And teaching how to do deep breathing skills is so critical, even if it's a minute, 2 minutes out of the day. There are, a ton of apps that are really good too with practicing mindfulness. And what I like about deep breathing is it's something that can be done in school too. Nobody has to know. You could be sitting at your desk, but you're mindful, you're present to the moment. You take your 30 seconds to do your deep breathing, get into a different headspace. What it does for your brain is it switches gears and it reduces your anxiety. Does it cure it? No. But in that moment, you can learn to reduce your anxiety. And the goal would be that you increase, do that more and more often each day to really help to reduce your anxiety. That's, a couple quick tips. Again, not a cure, but something to really try to alleviate the anxiety.
I love those tips, and breathing, I think, especially, is something that's so powerful that's definitely underutilized.
Yes.
Because, breathing's been shown to change the way that our brain chemistry is, actually performed. It changes the way that, we experience like our own present moment. It changes the way that we can perceive reality. It's, something like you said, it's like a minute can drastically change the way that you experience your whole entire day. And I think that's what it becomes so complacent, I think, for a lot of people, because they think that, or they don't even think that breathing is something that they need to be like mindful and aware of. It's something that they have just, succumbed to based on condition, based on just what they do every day. And I think once you start to become aware that, if you just breathe in through your nose and out through your mouth and actually become cognizant and aware of that, it really brings into a whole nother perspective of that, what you experienced 30 minutes ago or what you're going to do in 2 hours does not matter. You are here, you are present, you are grounded, and your breath is, something that you can be tangibly with and, succumb to, which I think can change a lot of mental health conditions, because it brings them to the point of awareness that nothing else can truly, change any type of harm or negativity that may have displaced, any of their thoughts or any of their emotions that have, dragged them down or have like held them to a lower standard than who they truly can be.
Yeah, it's really powerful. As you mentioned, I'm glad you used that adjective. It is so powerful. Another thing is, I believe, I can't remember what country, but somewhere in Europe, I was seeing this online, which I thought was so cool. We're not quite there yet in the US, but some of the physicians were writing prescriptions for youth to spend time in nature. And I thought that was so cool. I was like, oh my gosh, because I'm a big nature lover, and I love to be outside, because for me, it's very calming. I know, everyone has their thing. So for me, it's very calming, but that's something that I've also seen with some youth, also just being outside, being in nature, enjoying a sunset, sunrise, playground, something. And just like you said, just sort of being grounded and practicing breathing and mindfulness. I mean, I've seen really cool results too. I haven't prescribed that, right, necessarily, but I've heard from parents some stories about how different their children are when they get outside. And for some children, it is about getting their energy out and playing, but for some children, it's just about, kind of being outside and being in nature. So that's something that, people may want to consider as well. Like I said, I know everyone has their thing that makes them happy, but that's definitely something that can be used, again, not for a cure, but can be used to alleviate some anxiety.
I love that one as well. Nature is something that I think I definitely love to enjoy, and it's something that I truly focus on. And, as you know, trees produce, much of the oxygen that's emitted to our world today. And I believe there's somewhere in Asia where I forget what it's specifically called, but they're basically like meditation classes where you walk around through trees, and
that is cool.
that's seen as like a technique in order to, breathe and be mindful of.
That is super cool.
That you're
I need to sign up for that.
Cool, right?
I need to buy one here.
Exactly. And I think it's just becoming aware of how powerful just being around nature, being around trees, being around different plants can offer, a different type of a breathing technique or just of a mindfulness approach that anybody can use, and it can be so beneficial to their health. And it could be as simple as 15 to 30 minutes that they go out and take a walk in nature. And I think it can change the course of, not only their day, but their week, because that perspective change can offer, great insight into, maybe if they want to be in nature more often, or, it helps them to see a different approach to, what they want to do.
Yeah.
Because that's one thing that I've learned is, the routines and the lifestyle that you have drastically changes the way that, you think and behave within yourself. And for a lot of people who are experiencing a mental health condition, breaking that routine barrier of like what you are doing compared to what you should be doing is such a large step. And it's so hard for many people, but that one change can drastically affect your mental health and, the way that you even just perceive reality around your own life.
Definitely. And especially for depression as well. And it is hard you're right, sometimes to make that change, but there's so many studies that even have shown, exercise helps with depression. So even it doesn't have to be hardcore exercise here, but even like you said, taking the walk in nature. I mean, it's kind of like a bonus here where you have the nature and you're walking and, you're getting some type of exercise to help with endorphins and help with depression and those sort of things, or it can be really, really beneficial as well. So it's really, and it's really about, a lot of times I get questions about stress management. And I could run through like a list of 100 things for people, but I want people to understand it's really about for you what works for you. Because again, for me, I know it works. I love my yoga, I love nature, I love reading, but none of those things may be important for you. But you may say, I like to do XYZ, and that reduces my anxiety, that gets me into a positive state or whatever it is. So do those things that work for you. But it's really about making a commitment to start to take those steps. But if it is too hard, if you've tried everything at home for your child or for yourself, and you're like, you know what, it's too hard, I've tried everything I can at home, then that may be the point where you say, okay, I need to reach out to a mental health professional. So it's one of those things, again, not everything is a disorder. Sometimes it is, and sometimes it's not. So
definitely, it's such a hard field to be in, because when you look at a physical injury, it's something that's way more pertinent to know and to be visible toward the person. And when they're experiencing a mental health condition, they might not necessarily know that it is something that is wrong, or is something that they are experiencing that is not something that they should be experiencing. So,
right.
Some could be experiencing depression and not know that it truly is something that they shouldn't be experiencing. It's something that they see as their norm, because
right.
oftentimes it's started at such a young age, and that translate into them thinking that it's just the normal aspect. And oftentimes that drives people into, whether it's manic episodes or psychotic breaks, because they don't truly understand why this is all happening. And I think that's the education that we can provide within school systems will make people more aware of what they're going through. If maybe, these thoughts aren't what I should be having, these are some of the symptoms of bipolar disorder, and that'll make people more aware to just reach out, just to seek out, any type of service, just to even evaluate them. I think evaluation is something that should be offered to so many people today, and it's something that everybody needs. It's everybody's going to experience some sort of emotional trauma or experience that can cause any type of harm within their life. And not everybody can handle that. Not everybody can just move forward and move past that. So having just a mental health professional to talk with can change the course of many years of your life. And mental health, I think, needs to be taken more seriously throughout our society in order for everybody to seek out the services. And it's got to be that normal conversation as we've been talking about.
Yeah, I agree with you. And I think that, I think when it comes to education, well, I think I've reached the point in my career where when it comes to the education that you're absolutely right is very needed when it comes to mental health in the community. At this point, and the schools are, slowly sort of trickling in with this piece, but it's going to take a while. And then there's a lot of school systems that say, we don't have the funding, or we don't have this, or we're not prioritizing this and all that. Okay, that's great. So while that part or system is being worked on, I think for people in the community, I love what you're doing. I told you this before, but I really love what you're doing with this podcast, for example, because it's getting information out there. If, whomever's listening to this is volunteering in any capacity in your community, how can you spread positive information about mental health services, conditions, something positive and reputable you read online? It's free. You share it. We're in the days of social media, whether it's a place of worship or community partnership or whomever. I think that piece also is really, really important for each of us to be doing. And I know many people listening to this, either you may be, yourself have questions about mental health with someone with yourself, or someone that you know and love, so sharing this information and making sure that we're all a part of the solution, if that makes sense. And it's so, I say it's so simple, but it really is. It's so simple sometimes, because we know that, certain posts, you send it out and someone's like, yeah, that's really good. They'll send it to the next person, send it to the next person. And then we're really able to spread the resources and spread the information. So like you said, when a 15-year-old is going through something and they're like, I have no idea what's going on with me, they can at least think, man, I read this thing, or I learned this thing in class, or I learned that, my church or wherever it was, that this could be going on with me. Let me tell my parents, and at some point we're talking about saving lives for some people. So it's just really important that I think we all reach out in this, because we really all have a part.
I completely agree. That's something that the message that I really try to push within my own audience is, anything that I share or that I, have read, or what I think is truly important, I want my audience to share to anybody who they see that could benefit from this. And even if it's not someone that you think can directly benefit from it, share it to your audience, because the numbers, 1 in 5 people are struggling from a mental health condition, and that's who we know of. So if not, it's probably 1 in 3. So within your own audience of whether it's a couple hundred, whether it's a couple thousand, the one message that you can share, one post or one piece of advice can drastically change many people within your audience, within your friends, within your family members, within your classmates, your coworkers. So it's just about offering those resources to as many people as you can. Like you're saying, it's, even if you're mentally healthy and you're going through such a great period in your life, you still need to share something that you've experienced before. You still need to share what helped you out of a hard time. And I think, that's what's going to, like you're saying, create a better connection within our society, create the better conversation within, our own culture today, because mental health is obviously seen as such a negative, where we need to create the mentally healthy and the mentally well individuals throughout our society. And mental health is not something that we should be scared of. It's something that we should all be focusing on, just as our physical health, just as going for a walk. We need to journal for 15 minutes, or we need to meditate or go into nature. And that's the conversation that we need to continue to push.
Yeah, I agree. I so agree.
Well, I want to thank you for being here today. And before I wrap things up, I have one question that I love to ask my guests. And it's picturing that you're going to be writing a book about your whole life story. And it can be about, any lesson, any experience that you've had throughout this process. But I want you to give a glimpse into what one chapter of your life would be. And it could even be in the future of what you're planning to do. But I want you to give a glimpse about one chapter of your life story and give us a little glimpse into, some of the meaning and passion behind that story, and, why it was impactful within your own life story.
Good question. Let's see, the chapter, I would definitely say that, and I won't name the name of the school, but something that it's still impactful to this day. It was a very long time ago. I used to work in the school system, and I'll never forget that, anyhow, I was trying to advocate for a child that they needed counseling and, emotional health and that sort of thing. And this is probably like 10 years ago or so. And the administration was like, we don't do that here. I'm like, well, what do you mean? And they're like, we are here for the academic. I'll never forget. It's been so long, but the administrative person told me, we are here for the academics, and basically we don't deal with the emotional health. which was really disheartening for me. And now, again, we're at a different place, thank God, a decade later. But I think that chapter of their life, it kind of spurred me, though, to continue to advocate for youth. So I think my chapter would really be about just and I can go on, but just some of the pushback from certain organizations about helping youth. But I want to not have that be a barrier for me as an advocate for youth, and to just keep pushing forward. I know it's a big goal. I know it's going to be hard, and I know we're still dealing with the stigma of mental health, but I really want to push forward with that and to spread this message to as many people as possible, because again, we're talking about saving lives and having better quality of lives for youth and for adults. So yeah, I think that would definitely be what my chapter is about, just not having that be an obstacle and moving forward and still trying to help youth and advocate for youth.
I love that response. I'm so grateful that you try to push that message, and you've had, that experience to help drive you to continue the work that you do. I think, not only what you're doing tangibly firsthand with children and with parents today is obviously so commendable, because we need as many mental health professionals to do such important work within our society today, but the way that you continue to advocate, whether it's through an interview, whether it's through just online social media, or whether it's through your show, I think, the resources that you're providing for many people is so awesome to see, because, we need as many people to continue this important conversation, to share these experiences and these lessons, so people who aren't seeking out the resources maybe have a chance to see why the services are so drastic and so needed for someone who's experiencing, such harmful conditions. Even if it's a little depressive episode, or whether it's anxiety, or whether you're experiencing bipolar disorder or schizophrenia, these are all conditions that need the hands-on services from a mental health professional. And it's not something to just be looked over. It's not something that's just the normal thing. It's not just who you are. It doesn't define you. And it's something that I think what you're doing and advocating for is so awesome to see. And hopefully we can continue to push this message and offer, these valuable insights for anyone out there to see why mental health should be our priority alongside any other physical health, emotional health. It's all important, and it should all be number one on our list. So thank you for being here on the Mental Insights podcast, Nekeshia. I really appreciate you taking the time.
Thank you so much for having me. And thank you for also doing this podcast. I'm excited.